We'll
Yeah,
keep
just
that in. Episode number 37, everyone. Welcome here. Today we're joined by Anna Dunn, very special guest. We're excited to learn her story. Anna, welcome to the show.
Thanks for having me.
yeah, this is super special because now um, you're playing the sport that me and my brothers love, which is super fun. And you and I have known each other for a long time. We had a lot of education classes together. So this is it's cool for me too to learn your story because we haven't talked in a long time.
Mhm.
Um, I want to start off by talking about perspective. I imagine that the last 3 years as a whole has changed your perspective on many things, and I would love to kind of dive into that.
Can you give us a quick rundown of the last couple years of your life before that so people understand where that perspective is coming from?
Okay. Okay. Yeah. Okay. So, not a not a volleyball player now, sitting volleyball player, but I played soccer all my life. Um, I actually met these two at Trinity, when I played for the Spartans, and yeah, just a very successful soccer career. I wasn't keen on going pro right after I had finished my time at Trinity, but was hoping when this Canadian league was made that I'd be ready for that and this year. But as you'll learn, my life changed very drastically, and yeah, life doesn't go according to plan. And I'm just going to give you some good examples of my life and how it didn't go according to plan. So you want me to tell my start off, tell my
Yeah,
story?
take us back to just after your time at Trinity there, and then uh, when you were diagnosed with your cancer and what happened following that.
Okay. So I have my notes to the side here just to let you know, because I honestly have a hard time remembering everything that happened because it's just like a blur. Um, but yeah, so if you see me look off to the side, it's because I have my notes there just to
Yeah,
keep me
no
on track.
problem.
So discovering I had cancer, so I was experiencing this on and off again pain in my right big toe in the 2021 season, at Trinity. And so it was very infrequent pain. I wasn't concerned, we're athletes, we play through pain. It's just typical. But the pain became more frequent and more severe in the 2022 season. So that was my last season at Trinity. But still, everyone, including myself, was treating it as if it was like a sports related injury. Um, but by the time the season ended, I couldn't walk on it. It was so painful. And I was sent for an x-ray, and that came back clear. So again, just we didn't know. I'm still thinking I have, I don't know, like a bone fracture or something's going on. It's not, cancer's not popping in my head because why would I have cancer? So I moved back home to Edmonton, go Oilers. Um,
No,
I'm
we're
I
cutting
needed,
that out
no,
for
you
sure.
can't cut that out. I was actually gonna wear an Oilers top, but I didn't because of you guys. So you're welcome. So
Wow.
you got to keep that in.
We appreciate that. We
Um,
appreciate that.
yeah, you're welcome. So yeah, anyway, I moved home and the pain was continually getting worse. And so I reached out to a sports medicine doctor who is actually a family friend, of my family. So her name is Dr. Marnie Wesner, through the Glen Sather Sports Medicine Clinic. And she looked at my foot and it was really like I'm trying to say, like if this was my foot and this was my big toe, the inside of my arch was really swollen and puffy, and then the knuckle of my big toe was also like very swollen and red. So she took a look at it and thought something strange was going on. This was not a typical sport injury. So she sent me for various tests. So I had a bone scan, came back clear, an MRI, and that's when they were like, "Oh, suggested to get a biopsy." And still, I'm like, "Well, what is this? Like, whatever." got my biopsy, and the results came back, and that's when I discovered I had a rare form of cancer called Ewing sarcoma. Um, so this is like a bone and soft tissue cancer, and from the research that I've done and my family has done about it, like we don't know the causes of what what made this happen. And for me, it's really rare. Like it's a really rare cancer in general, but it's very rare for my age group. Like if anyone were to get it, it's typically children and teens. So yeah, 20, I think I was 23 at the time. And yeah, just discovering I have cancer. So I called Dr. Wesner, who explained the results, and she kind of went through everything, what this means, and kind of warned me like worst case scenario. I mean, case scenario is dying, but for me, worst case scenario was an amputation. And I just remember on that phone call, like she was like, "Yeah, you might have to get your foot amputated," and I just like lost it because as a soccer player, not having a foot is a little bit of a problem. Um, so I just like I was honestly just kind of stuck in this state of shock and denial. I was like, there's no, this is wrong. This biopsy's wrong. Everybody's wrong. There's not a chance. Um, and then days later, I was meeting with my oncologist and learning about my treatment plan. So it was like a very quick turnaround because of like the cancer that I have had, I don't have anymore, had it's very aggressive, and me being young, they were like, okay, this is a life that we can save, not just like a maintenance of, oh, you're always going to have this cancer, but we can keep, keep your life going. It was okay, let's get rid of this cancer. So thankful for that. But yeah, at this point, this is where my world turned completely upside down. So I had a port inserted into my chest, like I can't even show you guys mark. There. So that's where the port went. And then like I have another mark up here. You can't really see it, but what they do is I remember getting this in. This was my first like mini surgery. And they freeze you. And then she like showed me the port. It's like a little, it looks like a button, and then it has like this, it looks like a cord going up it. And basically they freeze you up, and they drape this curtain over you so you can't see what's going on. Uh, thank goodness. And then so there's a nurse by my head kind of talking to me, and she's like, okay, like everything's good, we're all calm, like trying to keep me calm. Meanwhile, I can hear the doctor and the nurse on the other side who are doing all the things to my scan, cutting me open and sticking this thing up my up one of my main arteries. And so I just remember being in there, and I was like, what is going on? It was the strangest thing. Um, but yeah, successful, didn't hurt. The other side, I actually, it's a funny story at the end when I had to get it taken out. They showed me it and they were like, do you want to keep this? And I was like, no, no, I don't want to keep that. Thanks, you can keep it.
Well,
But yeah,
You remember Pierce?
yeah, yeah,
He has his shin like whatever. He got a long piece of iron in his shin for a long time, and now it's a
yeah.
bracelet. You got like
Oh, sorry. I guess I should have kept it to make it into a bracelet.
or a necklace, like a nice little necklace. That'd be cool.
Regrets. Should have been better. Sorry, guys. Um, but yeah, and then I had to take it was like required to take a chemo class before I started chemo, and it basically this class just told you about all the awful things that were going to happen to you being on chemo. So really positive meeting. Um, and then this was kind of 2 days before I started my chemo, I decided to shave my head, and this was like just like so incredibly difficult, um, and just a massive loss of identity. Um, I don't know how it is with people with short hair, but at least like for me with long hair, it was like part of who I was. It was something that made me feel confident. It made me feel myself. And so like shaving it was like a really traumatic experience. Like I remember going to my hairdresser's house. Thankfully, she did it at her house and not at the salon. And so went to her house and I couldn't even like I just couldn't look up. Like I just kept my eyes shut. I looked down and I'm crying the whole time. My sister and my mom are there just holding my hand and I'm crying the whole time. And she's like, okay, we're done. And like I couldn't even look at myself in the mirror. Like I just looked at the ground and like I could see my hair like everywhere. And oh, sorry, it's hard for me to tell this, but yeah, like just like seeing that and you're like, oh my gosh, like this is real. So yeah, it seems funny because you're like, oh, it's hair, but like as someone who really identified with their long hair, it was like, yeah, just a very traumatic experience. But the reason I did it was because I wanted to take control of a situation that I had such little control of. And I knew it would be so much more traumatizing for me if I'm getting my chemo done and I go to bed one night and I wake up and there's just like chunks of my hair on the pillow. So for me, it was me taking control and I'm really glad I did it in the end. But as you can tell in my voice, it's something that was really hard for me. So yeah, moving on to where my
Well,
treatment began.
we really
Or you
appreciate
want to
you
talk about
sharing
that?
this. Yeah, no, I think this is awesome. I just want to say it's really um you got to be really brave to share stories like that. And I know we're not done. We just started, but just wanted to say it's a safe place and we really appreciate you sharing with us. It's
Yeah.
cool.
And you got me tearing up a little bit there.
Yeah, I got
That was powerful.
Oh gosh, you guys. Don't say that. You're not crying, I'm not crying. We're gonna make it through this.
Yeah.
Um okay, so now chemo treatment starts. So from the moment that I was diagnosed um to my treatment, it was only 3 weeks until I started. And so very quick turnaround. And basically if the cancer was left untreated, I would have killed me. So it was, we need to get this done. We need to start now. Um, so the chemo treatment was administered here in Edmonton at the Cross Cancer Institute. And it's this world-class facility for treating cancer. And luckily, I only live 12 minutes away from it. So I consider myself so lucky in a time where it felt like I just was getting smacked by the unlucky stick. Um, that was something where I was like, oh, it's a positive. So I'm really thankful for that. So yeah, moving on to my chemo treatment plan. So I had 14 rounds of two types of IV chemotherapy scheduled every 2 weeks. So the first one, it's nicknamed the Red Devil, and that one was for 4 hours, just one day. And so it's nicknamed the Red Devil because it has this bright red color and it has extremely severe side effects. So yeah, first hearing that, I was like, let's go, Red Devil, all right. And then yeah, I would have the 2 weeks off to for my body to recover as best as it could from that first one. And then the second chemo, I don't remember the name of it, but it wasn't as harsh physically, but I would say much more, it had a much more like bigger impact on me mentally. And so this one was 8 hours a day, 3 days. So 8 hours the first day, 8 hours the second day, 8 hours the third day. And then you go on.
Wow.
Um, yeah.
What can you explain what chemotherapy actually does? Like they're running an IV of something through your bloodstream trying to kill the cancer. And what does
Yeah.
it feel like when you're there for 8 hours on this IV?
Um, so yeah, basically chemo is just it kills not only the bad cells, but it kills the good cells. It kills all your cells because cancer is a fast growing cell. So it kills all your fast growing cells. And so I had my port, so it got inserted through there. So every time they would stick like a needle in my chest and like, painful for 1 second and then you're fine. And by the end of it, I was like, I had so many needles. I was like, yeah, whatever, just stab me, it's fine. But I mean, you don't feel anything when it's going in. It's just you see the bag, you see the big bag of like the chemo drug, and it's just going into you, and you're just hanging out there. Like most of the time when I was at chemo, I would be like coloring, like those adult coloring books. I'd be doing those, or I would be watching movies or TV with my parents because they came to every single chemo session. And just like those kind of things, something to keep me busy as best we could, card games, whatever. Um, yeah, does that answer your question?
Yeah, yeah. Because I know that chemo is like really hard, right? You hear that all the time that like it's
Mm-hmm.
difficult on people and on their bodies when they're going through chemo. And I'm wondering like if it's during the process or is it more like the recovery after?
Um, so for the Red Devil one, I felt fine. Like the whole time, felt fine that rest of that day, and then day two it hits you. Versus like the one that was 3 days for 8 hours. After the first day, I was already feeling it. The second day, and by the third day, I was like a zombie.
Yeah, and it's probably tough to describe, but because it's just killing like cells from
Yeah.
inside your body. I like what does that feel like?
Um, well, do you want me to? I can share the side effects of treatment. That answers
Sure,
your question.
sure.
So physical side effects that I experienced, again, it's not for everybody, but I was like really fatigued after. So like I would spend usually the second and third day after my chemo treatment was done, I would spend like the entire day sleeping because I couldn't get up, or I'd have the TV on, but I wasn't even watching TV because I like things weren't processing in my brain. I was just so physically and mentally tired that I couldn't focus. So fatigue was a big one. You guys are gonna laugh, but like constipation, that's a big one. So you've gotta take they don't tell you this at the start in my chemo class, which I was really mad about, but like you gotta be taking some laxative to help you get the body moving, and you're not eating a ton of food anyway. So yeah, it's really key to take some laxatives. And then hair loss, of course, but that was not a problem for me since I shaved my head. Lack of appetite, that's a big one. Um, Especially for the first, like you follow like this classic chemo cycle, and it's, you have your chemo, you're up here, and then it goes down, and then you're like slowly come back up, and then as soon as you're at the top, they hit you with another round, and you go back down. So it's just over and over and over again. Um, so yeah, I would usually get my appetite back, I want to say by the fifth day. And before that, I'm eating crackers. I'm eating like apples sometimes if I can, keep that down. Like, yeah, just very basic foods. Um, and then you get mouth sores. I only experienced mouth sores twice, but they're horrible. They're just like they're in your mouth, and it makes eating hard and drinking hard. Like it's painful in your mouth. So that was brutal. Thankfully, I only had those twice. And then just overall body pain. Like your body is just aching all the time. Like I don't know how to better explain it other than that. Like it just hurts. It hurts to move. Like you don't want to move. Um, then something I never experienced. I'm super lucky that I never vomited when I was on my chemo, which is like super rare. But I never vomited, so thank the Lord that that didn't happen to me. But definitely, I experienced nausea, weight gain. Like for me, that was another thing for identity that was really hard. At the end of my chemo, I weighed 40 pounds more than I weighed before. Like it's nuts. Um, and that's due to the drugs that you're taking to help. combat the chemo side effects. And then the big one is fever. So with my type of chemo, I'm not sure. Again, I can't speak for other types of chemo, but if I ever had a fever, it was immediately you're going to the emergency room. And I was, I don't know, I was admitted 5 or 6 times due to fever. And I will just say, like, I won't talk about my ER experiences because they're brutal, but yeah, it's just not a fun place to be. And I wouldn't recommend it to anyone. Of course, we don't want to go to the ER. Um, what else? Okay, so like mentally and emotionally, you get like, I don't know if you've heard of it, but it's chemo brain or like brain fog. And that's when you kind of have it's memory problems. So like I couldn't remember, I don't know, very basic things like what had happened the last day, like what day of chemo was I on. I couldn't remember those things. Trouble concentrating and focusing. Again, that kind of like, of course, I was fatigued. I just, yeah. So I brain fog was a big one for me. Um, Stress, loneliness, anxiety, hopelessness, depression, the the whole thing. There you go. You get those. And I actually have a funny story about chemo drugs with my oncologist. So this was like 3 or 4 rounds into my chemotherapy, and I was like, I was severely depressed, and like it felt more than just depression like from chemo. I was like, something's not right. I don't know what's going on. And I was like, I need to talk to my oncologist about this because this isn't normal, even though what is normal when you're on chemo, but yeah, it wasn't like right. And so I talked to her and I was like, what is going on? I'm so depressed. I'm so like sad all the time. And she has obviously hundreds of patients and she's like, oh, what chemo drugs are you on? Like to help combat them, like my medications. And so there were like 4 main ones, but as soon as I say this one, she's like, oh yeah, that one causes psychosis. And I was like, oh, good to know. So in case you don't know what psychosis is, it's basically you have like a loss of reality. And it's just, yeah, I was having basically psychotic episodes constantly, and I didn't know what was causing them until my oncologist decided to share with me that this chemo drug causes psychosis. So
That's wild. And
yeah,
did they purposefully not tell you, or is it just like you're on so many
I
drugs and
think
so
it,
many appointments that it got kind of slipped through the cracks?
yeah, I think it just like, yeah, it slipped through the cracks. Like, I think it wasn't for the purpose of, you should know this. It
Yeah.
was, oh, I forgot to tell you.
Seems like a big
Um,
piece of information that shouldn't be slipped through the cracks.
yeah, that's what I totally agree with you on that.
Hmm.
It's brutal.
Wow.
I
Okay.
have so many thoughts and questions, but let's finish the journey and then we'll
Okay.
get into them.
Yeah.
Okay, I will try and get through this. Okay. I lived in isolation for a year, so it was like basically me going back to like COVID-19 protocols. So no one was allowed to come visit me at my house other than obviously my mom, my dad, my sister, and her boyfriend, now fiance, um, were the only people that could come over and visit me. Um, and I also was so depressed that I didn't want to talk to people over the phone. So my friends would always be texting me, like, how are you doing? Or wanting to FaceTime. And like at that time, I didn't want to talk to anyone. Like life was so miserable for me that I just kind of had this whole like social withdrawal because I just I couldn't handle it. And kind of like another thing that I didn't want people to see me was because of the way I looked. So I was puffy. I had like this pale, sickly, gross, yellow, white skin tone. I had no hair. My eyebrows fell out. So like it wasn't looking good. So I didn't want anyone to see me like that. And then also kind of as a result of like my social withdrawal, I guess, is I deleted Instagram from my phone. Um, because I couldn't handle seeing good things happening to so many people. So like my friends are getting engaged, they're moving up in their work, they're traveling, they're moving out, they're, you know, spending time with one another. And I'm seeing this while I was like, I'm at rock bottom and this is what I'm seeing. So for my mental health, I was like, I need to delete this. So kind of went off of Instagram for, yeah, basically that year, which it was good for me. But yeah, it was hard because I missed out on a lot of like information. Like I feel like our generation shares so much information on Instagram and like those kind of social media platforms. So yeah, that kind of sucked, but it was good for me. Um, and then I was just constantly questioning, like, I don't know if you have your viewers. I don't know if they believe in God, a higher power, whatever, but like I believe in God, and so I was constantly questioning, why did God do this to me? Like, did I do something wrong? Did I screw up? What did I do to deserve this to happen to me? And I couldn't comprehend it. My logical brain kept thinking, you've done something wrong to deserve this. And it's not like I've ever thought that about other people who've had cancer. I'm like, no, they didn't do anything to deserve it. But for me, it was just, I couldn't wrap my head around the idea that sometimes bad things happen and it's just tough luck. Like I couldn't wrap my head around it. And that definitely contributed to a lot of depression. And ultimately, I learned like God didn't give me cancer, doesn't take away cancer, but He gives me the strength to fight it. So that was a kind of good outlook that I learned later on. Took me a while to get there, but yeah, I learned that later on. And again, during my treatment, I was constantly asking myself, why am I putting myself through this? Wouldn't it just be easier to stop the treatment and, let cancer take me when it was my time? And it's just like, I had those thoughts daily. And, um, it's something very sad to think about is like, I was thinking about like, oh, like death would be better than doing this, because it was so hard. Um, and I think that's when I really realized how much of an impact other people have on you and like how important relationships are. Um, because I would always respond by saying, like, I can't leave my people. Like, I can't leave my sister. I can't leave my parents. I can't leave my family. I can't leave my friends. It would be unfair to them. And I don't want to be the cause of sadness for any of their sadness. So, we have like our intrinsic and our extrinsic motivation, all our sports psych stuff. I love sports psych. And so I was extrinsically motivated based on other people. Like I was doing it for other people. I no longer had that intrinsic motivation, like I'm doing this for myself to get better. No, it was about I'm doing this so that I can survive, so that I don't cause sadness to the people around me. And this kind of got me thinking about how powerful an impact you can have on someone's life. Um, it's kind of crazy to say, but you could be the reason that they keep fighting and keep living. And that's something like it literally gives me like goosebumps when I say that. And it's kind of stuck with me ever since. And you may not know and you may never know the impact you have on someone's life, but you could be the reason that someone keeps enduring or pushing through like their version of hell, um, even when they don't want to fight anymore. So yeah, that's something that really, really stuck with me. Um,
That's beautiful.
now.
That's that. Oh, I also got goosebumps.
God, I'm glad. I'm here cause. No. Um, and then yeah, so I started to go to therapy because I couldn't cope on my own anymore. Therapy was such a game changer for me, and I just want to like, here's my like plug, my own self plug here. But like, I encourage like anyone who's struggling psychologically or emotionally, like go get professional help. It is so important. Your mental health is so important, and like as athletes, you we struggle with mental issues ourselves, like performance issues, whatever it is. But yeah, I would just say get help, is my kind of summary. Can I move into my amputation?
Let's
Any
do it.
questions?
Let's
Yeah.
do it.
Okay. So 8 cycles into my chemo, I met with my oncologist, and she said my tumor in my big toe was responding really well to chemo, and it was shrinking. So in my head, I'm like, okay, like let's keep this chemo up. It's gonna be gone. Like I never had cancer. Um, I was informed that actually an amputation was required. So I met my orthopedic surgeon. His name is Dr. Paul. Amazing, love him. And he took kind of, we went to, I remember going to, I forget what hospital he works out of. We went to the hospital with, I'm with my parents. Thank goodness they came with to me with came with me to everything. Because I wasn't processing things at that time. Like it just went in and out, like in and out one ear, you know. So he kind of explained what an amputation would be like, told me my options. So I could either get like the big toe removed, or like I was showing my foot like this. I could get it up to like the ankle, so I still had like my ankle joint, or I could get it from below the knee. And he said based on my lifestyle, so I've always been like a very physically active person, the below the knee amputation was the best option, because prosthetics were so much better for below the knee versus ankle toe. So we walked out of that meeting, and surgery was planned for November 24th. And at this time, chemo was paused because I needed to have the ability to have like white blood cells, because it kills off white blood cells. Shocker, it kills off everything. I needed to have the white blood cells to help me fight whatever is coming my way. So I just remember like being in the room, like when he's telling me about this, and you know, we look back, as I told you, like the first time I heard the word amputation, like I bawled, I freaked out, but I was so calm and unemotional and objective. And I think it was just because I was in shock and I wasn't fully processing it. Like an amputation, why? That why me? And so yeah, that was yeah, being in his office, and I was just kind of there. And my parents took notes, thankfully. We talked about it, and yeah, so it was decided November 24th would be the amputation date. So leading up to surgery, I kind of reflected on life and where I was a year ago. And I remember, you know, I'm a university athlete. I just finished my last year in youth sports. I was a teacher, I was a soccer player, like all these things about my identity and how much had changed. And it was just like shocking to me. And um, yeah, it was hard to think about leading up to that this was going to be happening. But the day of surgery came, and I was again like driving in my car. I actually like I had to consult my parents a lot on like my notes, because again I forgot a lot of things that happened, and they were there through it all. So in the car, my mom and dad are driving me to the hospital, and again I was just like kind of like it was kind of creepy how calm and unemotional I was. I was like, okay, we're doing this. And so get to the hospital, I check in, you know, you have to go through all the forms saying that like you are consenting to having your leg amputated and all this stuff. And so the nurse, she gave me a Sharpie. And this is where I'm kind of like, this is weird for the medical system, but I know they do this with any kind of like operation you need to get on your legs. I don't know, the arms, whatever. But she was like, okay, yeah, like write yes on the leg that's getting amputated and no on the leg that's not. And I'm like, I, dear God, I hope they know. I hope they know which leg they're operating on.
Yeah.
Because how like wake up and it's actually my left leg that's gone. And no, it was my right leg that had the cancer all along. So yeah, that was, I just remember thinking, I was like, what the heck is going on? But yeah, had to do that. And then, change into the gown, whatever. And they wheeled me into the pre-op room just outside of the operating rooms. And so at this point it had set in, and I just remember my dad was holding my hand because my dad came with me. I could only have one person with me through the kind of check-in process. And so I'm crying to my dad at this point. And I just kept repeating how I don't want to do this. I don't want to do this. I can't do this. And he just held my hand, and he kept repeating something good will come of this. And we don't know what it is yet, but something good will come. And yeah, he just kept telling me that, and held my hand, and then it was about 10 minutes of that. And then the nurse came in and come to get me, and she wheeled me into the OR. And the surgery team, sorry, I'm good. The surgery team quickly introduced themselves. Great, nice to meet everybody. Obviously the whole time. And then the anesthesiologist put the mask over my face and count down from 10. And I was in my head, I'm hell no, am I falling asleep? I'm getting up and I'm running out of here. And I think I made it to 5, and then I was out. And then yeah, out, and then waking up after surgery. I remember just waking up in bed and very groggy, whatever. I'm on so many drugs, so many pain medications, all this stuff. But the first thing I asked my parents was I asked, is my leg gone? And they responded saying yes. And sorry, that's another part that makes me a little emotional. I kind of took off the covers of my right leg and just sorry, 1 second.
Yeah, take your time. Take your time.
Okay. I take the covers off and I look down, and my leg's not there anymore. And I wasn't crying like I am now. I was just very motionless and just numb to it. And I mean, I was hopped on a lot of drugs, so I don't think everything was registering, but yeah, I just kind of kept staring at it, and it just, I don't know, it just was very hard to register. So yeah, I stayed in the hospital recovering for about 5 days, and then I was discharged. And then I experienced really bad phantom limb pain. So I try to explain it. It's hard to explain unless you've experienced it. But yeah, I'll do my best here. So phantom limb pain is basically when you feel pain in the body part you no longer have because of your amputation. So my phantom limb pain was in my right, below the knee. And so it's very real. It's very painful. And my best way of describing it is as if someone is just electrocuting your leg over and constantly, and it's just it's it's so painful. I don't know how to say it any better, but it feels like you're being electrocuted. And so yeah, that was I'm happy to talk about that more, but I want to make sure we get through everything. So that was just another challenging part of my journey, is phantom limb pain. And then kind of my wound healing, it actually took 6 months due to the chemo, as I said, killing the good cells that were required for healing. So most people who get amputations and are not on chemo or have cancer, they recover much quicker, within, I want to say 2 months. I was 6 months. So I had basically this open gash on the bottom of my leg where my leg used to be for 6 months, which was Like just it was gross. But yeah, here to tell the story, so we're good. Um, so my life kind of became like I'm crutching, I'm wheelchairing. Um, I crutch around the house, wheelchair outside the house, and I have some funny stories now to tell, share with you. So West Edmonton Mall was the place. Like my dad would wheel me around West Edmonton Mall, the whole top floor, the whole bottom floor, just basically for me to like waste time because days would go by so slow because I was just sitting at home. So we have two funny stories from West Ed. Um, so the first one is I had gotten like a disability badge by that time for parking because I couldn't, I couldn't walk. I was in a chair. So we got a disability badge, and so we're driving, and we get to the mall, and we're going to like our usual disabled spot, and there's this truck in the spot, but it's actually taking up two spots. And like my dad is livid. And I'm like, oh my gosh, dad, it's fine. Like, just park further down, wheelchair me in. It's not a big deal. Like, I just didn't want to make it a big deal out of it, whatever. And so we park further down. My dad's wheelchairing me, and we're wheelchairing in. And then he sees this guy go to the car or go to this truck. And he's like, I'm putting you in, like, I'm leaving you at the door. I'll be right back. And I'm like, oh my gosh, no, 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 doesn't listen to me. So he goes to this guy and he's like, like, you're parked in two disabled spots. And the guy's like, yeah, like I'm working on, he was like, working on the outside of the mall, like doing some repairs or whatever. And my dad's like, oh, that's my daughter over there. Yeah, you're kind of taking one of the spots that she needs. As you can tell, she has no leg, she has no hair, and like yeah, we can only wheel her. So you just took one of her spots, and I'm just mortified. And this guy like looks at my dad and he's like, oh, so it's a fun little parking story with my dad,
That
and
sounds like a great dad.
he
Like
is
that's
a great
almost like
guy.
now you look back and you're like, that was really special. Like he really stood up
It,
for me.
yeah, no,
Yeah.
and he's Scottish, so like he gets fiery, and when you get him mad, you don't want to get mad. So having this like Scottish guy like yelling at him, it was pretty hilarious to watch.
And wait,
Now that
sorry,
I think about it,
correct me if I'm wrong, but he's a sports psych, right? Is that true?
yeah, my dad is a sports psych.
Okay, I
Yes,
want to I want to get into that later because I think that'd be cool. But continue.
for
Okay,
sure.
keep going.
Okay, and then my other funny story. So me and my dad had done like our rounds at the mall, whatever. We're leaving, and it's like winter at this time, so it was like really snowy and slushy to kind of get through to the parking spot. Like you had to kind of cross the road to get to like my special disabled parking spot. And so I was in this wheelchair that like we had borrowed, and this was a wheelchair. It did not belong outside. It belonged like in a hospital. Not shouldn't have been outside, but you know, take it outside. And so my dad is like talking to me. We get outside, and it's like before we cross the street, and he's like, I think like if we take a run at this, like we'll just like, like go like straight through. Like it'll be great. Like it'll be much easier than me trying to like slowly push you through. And I'm like, again, I'm so out of it, whatever. I'm like, okay, fine, like do what you want to do. And so he like winds up and he's like starts sprinting, and then as soon as we hit the snow, like I'm like go flying forward. I don't know how he grabs me by like the collar of my shirt and he's like holding me, and I'm like choking, I'm crying, and he's like he like pulls me back into the chair, but I'm like so close to face planting again. I have no leg. I look sick. It's all bad. And so he yanks me back in the chair. He's like, I'm so sorry. And he felt so bad. And I'm crying just because like I was just in shock
Yeah.
and like scared. And he was like, oh, like I'll wheel you inside, and I'll come and get the car and drive it up to you. And so he wheels me inside, and this one lady had witnessed the whole thing. And so my dad goes back out and she comes up to me and she was like, "Do you need me to call mall security?" And I was like, here's me. And I'm like, "No, like that was just my dad." And she like was like, "Oh," and then like walks away. And I'm like, "Oh my gosh, just so embarrassing." But like this lady thinks like this random stranger is trying to like kill me, like put me run me through the snow and ditch me. But yeah, so that was another story. I at the time I wasn't laughing, but I look back on it, I'm like, oh my gosh, it was hilarious.
That,
Um,
that's so funny.
it was yeah, it was pretty brutal. But yeah, so I had like just like this whole loss of independence, right? Because I couldn't drive. I'd lost my right leg below the knee, so that's you use your right leg to drive. So couldn't do anything without relying on my parents. And yeah, just this loss of independence was another thing that was really hard for me. But chemo continued after. Um, so happy New Year's to me. Chemo restarted New Year's Day. And I had to finish 6 more rounds. And in my head, I'm thinking, you just chopped off my leg. Like, why do you need me to do more of this? I was really like angry about it because I was like, this doesn't make sense. Why are you making me do more chemo when you've taken my leg? You've done this and but you need to do more. And in hindsight, like yes, they needed to do more to make sure like none of the cancer had spread. But yeah, I was really mad about it. And so I ended up getting hospitalized for 4 out of 6 rounds of chemo with neutropenia, which is basically your all your white blood cells, which like fight infections and stuff. Um, they're all like basically dead. Like I had no white blood cells. So again, I was severely immunocompromised, and in total, I spent 32 days in the hospital. Um, and each time I was in the hospital, I mean, it's a good thing. I was like had my own room because I was in isolation and because I was so immunocompromised. But like, every time my parents, the nurses, and anyone came in had to like fully gown up, mask up, like to protect me. Um, and again, like that's obviously just like such an isolating feeling. You don't get to see like anything, anyone. You're seeing your nurses and your parents. Like that was it. And yeah, so it was just like overall, that was just a very challenging time. I'd lost my leg, still was doing chemo, isolated, just overall miserable. Um, but then finishing chemo, I finished my last chemo treatment on March 27th of 2024. And I mean, you guys both have me on Instagram, but like my video of me ringing the bell, and under the bell, it says, ring this bell 3 times well. It's told to clearly say, my treatment is done, this course is run, and I am on my way. And so this was like, it's a huge deal for someone going through cancer to get to ring this bell. And, um, as you guys, I'm sure, have seen in my video, like I, I bawled after ringing the bell. And it's hard to put into words like what I felt after ringing it. I think it was like just this mix of emotions of like so much joy, utter exhaustion, massive relief, and just like this release of so many negative emotions. So it was a really happy time, but there was still so much on the road ahead now because I had an amputation. So what's that going to look like? Good to go on.
Yeah, no, that's
I just want to make sure I'm not like eating up all the time.
no, this is fantastic.
We can take as long as we want, really.
Yeah.
There's no rules.
No,
Okay. I just like don't want
the
to take up all
stories.
your time.
Yeah, no, this is fantastic. Um, so you're done chemo, you're moving into, I'm assuming, some kind of, what do you call it? Not therapy, but
Rehab.
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 Yeah, some kind of
Yeah.
rehab. Can you walk us through that process? And then maybe by the end of that, we can get into moving back into sports.
Yes, for sure. Okay. Yeah. So, uh, before I got my prosthetic, I'm kind of just hanging out waiting for this wound to heal. And so my sister set up a meeting with Heidi Peters, who she's a Paralympic sitting volleyball player on the Canada Women's sitting volleyball national team, and she's bronze medalist. She's a big deal. She's really good. And I wasn't going to speak to her about sitting volleyball. I was just kind of going to speak to her like as an athlete with an amputation and a prosthetic because I had no idea what to expect. Um, my sister kind of forced me to go because I was just like so reluctant at the time because I didn't identify as an amputee or a cancer survivor. I still identified as a person without an amputation, even though I wasn't. It's hard to kind of explain, but I felt like as soon as I started talking to people with amputations, like, oh, you now have an amputation. So I avoided it for so long, but my sister was like, you need to talk to somebody because again, I wasn't doing well. What's my life going to be like? So had a great conversation with her about life as an amputee, and it gave me confidence and like inspired me to approach prosthetic fitting with like a positive frame of mind. So my prosthetic fitting process is so it's a long process, and I developed like a really amazing relationship with my prosthetist Lisa Peters. I did rehab at the Glenrose. Again in Edmonton, that's only like 20 minutes away from my house. Again, lucky that I had that. But so it's called the Glenrose Rehabilitation Hospital. I can't speak English today. And so that's where I was learning to walk again. And um it's so weird to think I actually like, you learn to walk as a baby, but you don't remember that. But like I vividly remember learning to walk um with my prosthetic. I went from like they have like old style like walkers that you see like elderly people use. Like I started with that, then I moved to crutches, then I moved to one crutch, then I moved to a cane, then I moved to nothing. But it was like it felt like a long process. It wasn't that long. They said that I actually went through it really fast. But I think it was about like 4 weeks of four times a week I would be going. Um,
Is
and it's
that
just like,
is that because of your athletic background? Like just because of
yes,
your ability to move your body the way it's supposed to move kind of thing?
yes, yeah,
Cool. Cool.
yeah. Um, so yeah, got through that. It was great. I was back to an independent life and I could walk. And I also learned to drive again, which is crazy because so now how I drive, like obviously you all drive with your right foot on gas and brake. Uh, I learned like through a driving simulator. I tried that technique with my prosthetic, but the issue was if I had my foot on the gas and then had to go to the brake, like my foot would get caught and I couldn't feel it. It would get caught, so I couldn't get it onto the brake. So obviously we don't want that. We don't want me on the road if I'm driving like that. So I learned to drive with both my feet. So that's how I drive now is my right foot is gas, left foot is brake. And it works for me. It's perfect. I had to retake my driver's test, which I was so mad about. I was like, really, you're making me do this again? Like just all these things, all these hoops I had to
What
jump
a
through.
money grab, hey?
Right? It was such a money grab. So, but actually, if it's actually because of an amputation, you don't have to pay. So
Oh, nice.
it was okay. It was okay in the end, but I
Yeah.
was still mad. Um, so yeah, got my driver's license and like I'm getting my independence back. I'm feeling good. And um, yeah, that's kind of where it ends. Uh, my whole journey.
That's fantastic and amazing and sad and everything all in between all at once. Thank you very, very much for sharing that. That's really cool, really special. I have so many
Absolutely.
questions. I don't know where to start. My first one, I think I want to start with My favorite part about that whole thing was the moment with you and your dad when he was holding your hand and he said something good will come of this.
Mhm.
What good has come out of it so far?
Um, I mean, sitting volleyball, obviously, like now well, I'm sure we'll talk about that, but never in my wildest dreams I think I would ever be playing volleyball because I hated volleyball. Up until 6 months ago, I hated it. And so yeah, so that's come out of it. I mean, like I got to meet like I mean, he's an Oiler, so I don't think you guys like him, but like I got to meet Mark Messier, who is like one of the greatest of all time. He's up there with Wayne Gretzky. And that was
And
through
Jerome
like a family
McGinley.
friend.
Yeah, yeah.
Yeah, okay, yeah. Oh, we're not quite on the same level, but whatever, you flamers, you guys say what you want. And just like being able to like accept that I am an amputee. I still don't identify with being a cancer survivor. Like that's just not something I identify with. And people, if they ask me, I'm like, yeah, I guess, but it's not like I'm like I'm a cancer survivor. That's not really something I like to talk about. Um, but I'm happy to talk about like being an amputee. Like, yes, I'm disabled now, but there's so much I can still do. So there were lots of good things that came out of it. And at that time when you're going through that, you're like, no, this is my world is ending. Like I can't play soccer anymore. What am I gonna do? When that had been my whole identity since I was when I started playing soccer at 5. So
Mhm.
um yeah, it got
That's
shifted
cool.
and
That's
lots of
that's
good
super
things
cool.
came from it.
I
Mm-hmm.
do want to get into volleyball soon, but another part of that of your story that really struck me was the part where you said you don't know if you're someone's reason to keep pushing. I think that was really cool and can be applied to many aspects of life or of hardship. Um,
Mm-hmm.
but my question is what advice would you give to someone who has someone in their life dealing with something as traumatic as cancer or amputations or something along those very, very life altering moments?
Am I talking as if I'm talking to the person who is like going through that, or the person like they have someone in their family who's going through that?
In their family or their significant other or something like that.
Um, yeah.
And I understand like you can't prepare for that. There's no way. There's no way you prepare for that. You're like, oh, when that happens, if that happens, I'm gonna do this. Like there's no chance.
Mhm.
But I think there's probably someone out there that might remember this conversation and things happen to people all the time that are you're unprepared for.
Yeah. That's a good question. Um, I think what I would say to someone if they had somebody going through this that was close to them is like just like be there for them. And it may look different for everybody, um, of how you're there for that person. So I had some of my friends who were there for me of like they would text me and ask me how I was doing, and did I respond to them always? Most of the time I didn't because I didn't want to, but like knowing that they were there thinking of me like was something that kept me going, as well as like my sister, like she's an accountant, she works long hours. She would come over after her crazy day and just watch TV with me. And it doesn't seem like that much, but at that time when I was going through it, like we didn't talk about stuff because last thing I wanted to do was talk more about what I was going through. um but just having someone there and knowing that they were there for me was just that was so important to me. So if I were to tell somebody, I would just say be present in that person's life in any way that you can.
That's cool. That's really cool. Well,
Okay,
okay.
I don't know how I feel about this question I'm about to ask, but you're basically going through hell on earth. You have this insane whirlwind of emotion and things that are happening to you. I'm wondering if you would have done anything differently.
Did anything differently?
Because I know
You know
there's like
what?
not much you can control, I don't think, in that scenario.
Yeah.
Yeah.
Um, hmm. Like, I mean, that's a good question. I think, like, you can't, like you said, you can't control things, a lot of those things. So I can't, there wasn't much I could change about what was happening. But I think if I could go back and knowing, like, kind of what I've been through now, if I could go back, it would be to not socially isolate myself as much as I did. Um, and like for the Instagram, for sure, that was like I needed to do that. I couldn't, it was so hard for me to see all these amazing things going on in people's lives, and that's not happening to me right now. I am stuck in a hospital, like like you said, like I'm going through hell. Um, but I think like just being more open to, who cares what I look like? Like I looked like a cancer patient, and people knew I was going through cancer. So, being open to FaceTiming with my friends and just like talking about anything other than what I was going through was beneficial to me. Um, when I started opening up more later on. Um, but I think I would have been so much better for me mentally if I had just let more people in. Um, yeah, because I just kept people out. And I think in the end, if I were to do it all over again, I would have made more of an effort to keep the people around me more kind of involved.
De- Definitely easier said than done, I would imagine.
Yes,
Yeah.
for sure.
Yeah, that's
Yeah.
why I wasn't so sure about that question because it's such an extreme scenario that
Mm-hmm.
it's not like you were making many choices, I don't think, or any bad choices. Like you're in complete survival. Um,
Mm-hmm.
wow. Okay, so
Well,
how did you find?
I have one
Oh,
question before we get to
okay,
volleyball.
okay,
I just want to go back to
okay.
my original question about perspective. Now that we have the whole story out, like even if it's something as simple as not taking driving for granted and being able to press the brake properly, like I'm just curious about what kind of perspective shifts you've experienced over the last little while.
Um, I mean, in terms of like a cancer journey, like viewpoint from that, um, hmm, perspective change. Like, I think, like, yeah, like losing independence was, you just never think you're gonna lose it. Like, and I think well, just in general, like, you never plan for these things to happen to you, but they like it can happen to anyone, and that's what I think I learned was I was like, me, cancer, not a chance ever. Like, will I ever get cancer? Maybe when I'm like super old, because a lot of people, get cancer as they get older. But like, I think it's just like I came to a realization that, bad things can happen to anyone. And like bad things can happen to good people. And because I generally like to think of myself as a good person. Um, and I think that just for me, that was kind of something that was hard to wrap my head around was, oh, horrible things like almost dying can happen to people who are, fantastic. Not saying that I'm fantastic, but, a little bit. But yeah, so I think that's a big thing. And then, yeah, taking like the independence for granted. I mean, now, like when I shower, this is like it's so basic, but like I miss showering standing up, which is so ridiculous. You're like, what? Why? But like I have to sit on like a bench to shower because I have one leg. If I slip, I'm I'm kind of screwed. So I have to sit down and shower. And that's something that like I miss. Um, but yeah, there's just like all of these like little things that you can't do with one leg that you took for granted before. Um, so I would just say like being thankful for what you do have. And it sucks that it kind of took me in order to realize that it took me losing my leg to realize how much I had and how lucky I was. Um, so I mean, if you can realize that before those kinds of things happen to you, like you're winning. That's that's a good thing.
Hmm. I think that's one of the unfortunate realities of life is that we just get used to our current scenario and we take most of what we have for granted.
Mm-hmm.
But maybe not after this podcast.
Yeah, hopefully, really helps with people.
We're gonna
Yeah.
change the world. We're gonna
Yeah.
change the world.
And also, like, I don't know about you, Anna, but I feel like you could do anything now that you've been through that. Like, I don't know if you'll ever have anything that will compare to that. I'll never say never because we just talked about that. But, but just like, yeah, it's incredible the amount of strength of character that I think you've developed going through that is unbelievable.
Well,
Um,
and had beforehand.
right.
Thank you.
Okay, let's talk volleyball. Let's talk volleyball.
Okay.
How did you get connected and end up on the women's sitting national volleyball team?
Yeah, congratulations on that. That's pretty cool.
Thank you. Thank you. Yeah. Oh gosh. Well, oh, so my prior experience with volleyball, none. I played in junior high and high school phys ed class. Like I didn't play on the teams, like junior team, senior team, not a chance. I hated volleyball. And I just remember, like, I don't know, I know for sure, Jesse, you played with Jacob Kern. Matthias, did you play with Jacob Kern?
Yeah, 1 year.
Okay. So Jacob and I went to the same high school. And so we were in our phys ed 30 class together. And like, this is just like, I just want to punch him sometimes. But he would on purposely, like when we were doing our volleyball unit, he would on purposely go on the opposite team as me. And when he got to serve or whatever, he would just absolutely smash the ball at me as hard as he could. And I have no, like, I don't use my hands. Like, soccer, what? Like, I didn't compute. And so he would just smash it at me. And I'm there, like, I'm like, why? Like, this sport sucks. Like, I genuinely hated volleyball. So I'm so sorry, but I hated your sport. So
Our
yeah, that was
sport,
that was pretty
our
impressive.
sport,
Yeah,
Anna. You're
our
on our
sport
side
now.
now.
Here, what am I saying now? I've come to the dark side. So yeah, that was my prior experience with it. But as I said earlier in the podcast, when I met with Heidi Peters, you know, through like bronze medalist in Paris, sitting volleyball player. Um, so my sister again, no, I don't want to say forced, but strongly encouraged me to go meet with her. And I was really reluctant to go because again, associating with an amputee, just like I didn't want to. Um, and again, I was meeting with her to talk about being an amputee in the prosthetic process, not at all about sitting volleyball. And I just remember in our conversation, she like kind of brought it up and she was like, "Oh, would you ever be interested in playing sitting volleyball?" And I was like, "No, like, no, never, ever, 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 never." And she was really good about it. She was like, "Okay, like, yeah, no worries. Like, if you ever want to come to practice or whatever." And I'm like, "Yeah, no, like, it's not gonna happen." Um, So I tried like other sports after I had my amputation, like rowing. It was way too complicated. Running, I couldn't do it yet because my bone wasn't strong enough to run on that leg. And I just like I love team sports. I'm a team sport player. Um, so I love team sports. And so this was in like I want to say like October. I met with um family friends, um Len and Roberta Vickery. Len, he was the former Bears soccer coach. He even coached my dad, like back when he played Bears. So um long time knowing him. And so his daughter was the physio for the Canada women's sitting volleyball team. And she asked her parents for like if I would give permission to share my information with the sitting volleyball coach. And again, like here's me thinking nothing's gonna come of this. Yeah, like sure, go ahead, share my information. And later, Heidi texts me and invites me to a practice in December. And I was like, no, I don't want to do this. But my sister was, again, she strongly encouraged me to go. And she was like, if you don't like it, you never have to play again. Just go and try it. And so I went and I actually like had so much fun, even though I was
Yes.
so bad. Yeah, like I loved it. And I'm like, what is going on here? And it's just like, I'm playing a sport with my hands. Like I didn't know I had hands before. And so I was so bad. And I feel so bad for Heidi, just this Paralympic level athlete playing with me who just doesn't know what's going on. I don't know how to, like forearm pass setting. What is setting? Like all these things, but I loved it. And so I've been playing ever since. So that was back in December, and I've been to like we have like a camp every month, and then we train twice a week, and slowly but surely I'm getting better. I'm still like 100%. I'm still like the drill kill, like easily the drill kill on the entire team. But like whatever, I'm trying. I'm like trying my best, and I'm learning, and I just like kind of I have a new appreciation for you guys and your sport. Like it's so hard, and I just not that I didn't think volleyball wasn't hard, but like oh my gosh, like are you playing in position one, two, three, four, five, six? What? Like what are the
That's the hard
positions?
part. The hard
That
part
like
is the numbers.
okay, the numbers, those are so hard. It's funny because in soccer, you have your typical numbers of like the 11 on the field. No, that makes perfect sense to me. Volleyball numbers? What? And then don't even get me started on like you guys are talking about rotations. What is a rotation? I don't understand. Like I don't understand what's going on. And then whatever, your left side and your right side, and I know middle is your person in the middle. So like
Well,
setter,
the left
you're
side's the
typically the
person on
one
the left, and
setting.
the right side's the person
Yeah,
on the right. Like
but
it's
like
not that difficult.
it's just so complicated for me because I think like as a soccer player,
Yeah,
and
yeah.
like so a lot of the times the coach, Nicole Ban, would have to explain things to me as like from like a soccer lens. So like she would,
Oh, that's cool.
yeah. So like I'm brutal at serving, and I was like, man, this would be like the easiest skill. Like I remember watching you guys at Trinity. I was like, yeah, whatever, like easy. No, what the heck? No one told me it was so hard. And so she was like, you got to think of it like you're following through on your on like a kick, like in soccer, like your ankle's locked, so your hand has to be locked, and you're following through like forward because of course I'm not doing spin serves. Like let's hope I can get a float serve over. And then there, look at me, I'm using volleyball terms. You guys be proud. And so like she has to explain a lot of things in a soccer way that I then apply to sitting volleyball, and it's so much easier for me to learn that way. But yeah, that's kind of that's where I'm at.
That's fantastic though. Like that is a great coach. And like
Yes. Oh,
I
she's
mean
amazing.
you understand that too from an education perspective, finding different ways to teach your students or your players
Mhm.
what works for them and the way that their mind works. I think
Hmm.
that's brilliant. That's really cool. I think we have a really cool opportunity here because you're an adult, but you're learning
Sometimes, yeah.
skills like many of our listeners are learning. Our target audience is younger athletes, but you have all this experience in high level athletics. What I don't even know what my question is. Like, what's the hardest part about volleyball other than serving, but or like, or I mean, what am I trying to say? What am I trying to say, Tias?
Well, I have no idea, but but yeah, maybe let's go through kind of what you're working through right now. But then also, I'm really curious about like what's your favorite part? So what's the highs and what's the lows, and what are you working on?
Yeah, that
Okay.
ditto.
Same. Okay. Yeah. Oh, the like the lows, I would say like I am I like to say I'm a recovering perfectionist. Like I just it's so hard for me and I think like looking back when I was younger, I never tried new sports. I didn't try a lot of new sports because I didn't want to be seen as like bad of like people like being like, haha, like she's so bad at the sport. And so I avoided a lot of sports when I was young because it was just like I couldn't put aside my ego of like these people are gonna laugh at me. And so um it's kind of like now as an adult, like it's like, okay, yeah, you have to put aside your ego and be okay with being the the worst the worst person there. And so I would say with sitting volleyball, like of course all the skills have been like so tough to learn because I don't I'm not a hand athlete. Like, I am not an athlete who uses my hands. Now I am. But I think it's been like super mentally challenging of like I said, just like putting aside that ego and being okay with being the worst on the court, like and being a drill kill. Like that's been so hard for me. Um, and I think like yeah, I mean your target is younger audiences, so like just being okay with like messing up. Like that's it's something that I've had to learn. Um, and I'm still learning. But yeah, I think those are the hardest things for me. Um, the things I most enjoy, oh goodness gracious. Um, I think what do I enjoy the most? Like I just love like being around like um the other players, like my teammates. I just feel like I don't know, I think in volleyball in general, but like sitting volleyball, I think like you're so much closer and you have to be so much closer for things to go right for you versus soccer, you're on a team of like 30 people. And so, you know, I may not even talk to this one person, but like one they might never pass me the ball in the game, or they'll pass me a couple times, or two, like they don't see the field because we only get five subs, and then once you're out, you're up, like you don't come back in. So I feel like a volleyball, you need to be so much closer because at any time on the court, you could receive the ball from anyone, and you need to kind of know and be on the same wavelength of like where they're at. So I kind of like the closeness, I guess. I don't know if that's the right word, but like the bond like that you have in volleyball that you might have with a couple of your teammates in soccer, but you need that with kind of all of your teammates in volleyball.
Hmm. It's a great point. I think volleyball is maybe one of the least selfless or the most selfless sports, especially because you
Mhm.
never control the ball.
Hmm.
Like in soccer, you can dribble, basketball, you can dribble. Most other sports, you
Yes.
can, yeah, you can retain possession by yourself. But in
Hmm.
volleyball, it's impossible. And then most other rebound sports, let's say like tennis, badminton, pickleball, whatever, anything where there's like a net in the middle where you're bouncing it over, you just give it back to their team. So I think volleyball is unique because you can't control the ball yourself, but you have to give it to a teammate. So I think that's like
Yeah.
that's where that closeness comes from, and you're absolutely right. I think that's why most, at least I was drawn, maybe Jesse too. I think a lot of my friends are drawn to volleyball as well because you got to be super tight.
Hmm.
You're muted there, big guy.
Whoops. I'm super curious um, about failure. One, your response to failure uh, as a newcomer to the sport, but also the fact that in soccer, you could win 1-0 and you experience no failure. And then in volleyball, you could win in five and experience like 75 points of failure. So what was that like for you?
Yeah. Um, I mean, like soccer and volleyball are just vastly different sports, right? Like in soccer, typically you're scoring one goal, two goals, hopefully having none scored on you. But yeah, like it's a very low scoring game. Whereas in volleyball, you're getting a point every time, which is just like, I don't know, it's so weird to me. I'm not used to it yet, but I will. Um, but I mean, like managing like failures and frustrations. I think for me, like I need to talk about it with somebody when I'm frustrated with myself. Like I hate being the drill kill, but I am. And so I love like talking to my teammates and being like, what do I need to do? Like, what am I doing wrong? They have so much knowledge that I don't have. Again, I'm a total rookie, novice, beginner at this sport, and they're so good. And so just like being able to ask them, like, oh, what am I doing wrong? How do I get the ball from here to there? And what is my most effective way? So I think talking with people is really good for me. Reminding myself that I'm not very good yet, like just like that power of yet, and just knowing, like, I mean, again, like you said, your target is young volleyball players. Like all your listeners, like they have so much potential. Like you have so much higher to go. And like the fact I'm 26 and I'm just learning this sport and I'm actually getting better, believe it or not, from the first time I practiced to like where I am now, I'm better than I was. I think it's just like that's so good to have that reminder of like, I'm not good at this yet. So like I'm not good at serving yet, but I will be. And I think that's super important for athletes as well to remember that. Especially when like if you're going through a dip in your performance, if you're having a really tough time with a certain skill, like the power of yet is so good, I think.
That
That's
is
so
an
cool.
incredible quote. Is that a
Yeah.
book or did you just come up with that?
There is a book called The Magical Yet
Oh,
that I
is
read
there?
to my grade ones. Yeah,
Oh, the great ones. That's funny.
my little grade ones. Yeah.
Cool.
But
I
that's
think,
that's a really interesting idea, the power of yet.
mhm. Yeah, I
Mhm.
love that, and I also love how much you're leaning on your teammates to help as well. We've talked about that a bunch as well. At any level, people are always trying to improve to get better, right? Even if you've
Mhm.
been playing for 10 years, I think the goal is always to get better. And I think there's probably um, missed opportunity to learn from those around you the longer you've been doing it. Maybe because you think you might know, or it's just not as new to you, so you're not seeking it out as much. But I think that's super powerful for athletes at all levels in any sport. Um,
Mhm.
Do you think there's any intangibles it will likely be that you bring to the volleyball court that give you an advantage over those who have only ever played volleyball?
Um, hmm.
Actually, I have a question I want to add to that. Is there anyone on the sitting volleyball team that has only ever played volleyball?
Um, that's a good question. Both of those are good questions. Um, I know like a lot of the girls on the team like had amputations when they were younger, so they've had their amputation for a while, so they've been playing sitting volleyball for a while. But like one 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 teammate, she played soccer up until she was 12, then had an amputation, and then has been playing sitting volleyball ever since. So I'm definitely like the freshest amputation. Um, but like other people have, I don't know if they've played like maybe they have played some sports, but I don't think at like a high performance level,
Cool.
like in university or whatever. So yeah, that's it's different.
Hmm.
Um, what I bring, oh my goodness. Oh, I mean, if we're totally taking out the skills part, um, I mean, I think like what I can bring is fresh eyes. Um, as someone who, again, I don't know the sport very well still. Like just asking, like when I ask questions about like, oh, why are you doing it this way? And then they're like, oh, I didn't even realize I was doing it this way. And then they'll keep doing it that way and be like, okay, this is the reason I do it. Or they're like, oh yeah, that's not good. Like I'll change it. But without me asking, because I'm asking a million questions of practice of like, why do you do this that way? Like, because I want to get better. So is that the way to do it? And I think I kind of, yeah, like bring those fresh eyes. And then um also for me, like being like in the sport of soccer, like I've been through, like I've experienced upsets. I've experienced like the highs and lows and the mental side. I think I mean, I don't know if this is just me because I'm new to like sitting volleyball, but like I find it's so much harder mentally. It's like, let's bring up serving here. I, it's like I can serve if I'm like like one butt scooch in front of where I need to be at the service line. I can hit it over. Like I'm good. But as soon as I get to the service line, I'm like, oh my gosh, like you have to get this over. You give a point if you don't, and it's just like, and it's like so much of a mind game with yourself. Whereas in soccer, I didn't find that um nearly as much, if that makes sense.
Definitely makes sense. I,
We
I
we all we all
we have
still
the
think
same. I
that.
was just gonna say you're
Yeah.
not alone. You're
Yeah.
definitely not alone. As soon as you go back there and all eyes are on you, the ref blows the whistle and everyone's just staring at you. It's like, oh, here
Yeah.
we go. Like, yeah, yeah. You're not alone. I'm curious about your dad being a sports psychologist. What role has he played in your newfound love for volleyball and your curiosity and desire to improve?
Um, I mean, I think like my curiosity and desire to improve has like come like from me. I mean, I get it. I think like I get it from both of them, like my dad, but um, I'd say like my dad, like he will come. He played high school volleyball. He's not like a very tall guy, so he played setter. So he loves to give me like he'll try and give me tips, and I'm like, okay, Dad, this is very different. This is sitting volleyball. You played standing volleyball, well, however many years ago. Like it's been a while. It's been a while for you. So, like I'm gonna take my coach's advice over his. But he is like so invested in helping me become better. Like he'll come to the gym. Like he's retired now, but he still does. Like he was a professor at the U of A, but he's retired from that. And so now he just does his sports psych business. Um, but he will like drop everything to come and just hit balls at me in the gym. Um, and you know, for another big thing for sitting volleyball athletes is shagging balls. It's a pain. But he's like running around the court as I'm going and just like load me up. And I think he's just so passionate and he's like, hi, just like I can't wait to see how far you go. And I mean, he's definitely helped me with some mental aspects. Like he was like my go-to sport performance coach, like um when I was playing soccer, because he knew soccer so well. Um, he played at a high level. Um, Not as much with volleyball, um, but he definitely still gives me like tips and tricks, like breathing. I don't know, like again, he's really good with me, like making sure like I'm not being so hard on myself. He constantly reminds me, Anna, you've been playing this sport for 6 months. Like you're not at the level that your teammates are at because they've been playing for however many years, you know? So he's also really good at reminding me that it's okay that I suck right now, but that I will get better.
That's fantastic. I'm You mentioned there that your dad is curious how far you'll go. And I'm
I
wondering,
was gonna ask this question.
yeah, I'm
Oh my
wondering
goodness.
I wonder if you have set any goals for yourself in volleyball and where do you see it going?
Um, I mean, the ultimate goal would be to make it to the Paralympics. Like that is, I would love, I would love to make it there. Even if I'm riding the bench the whole time, I would be happy to be there. Um, so yeah, like I think that's like the big dream. I mean, we're in like the first year of the quad. So um, I got time to do some drastic improvement if I'm gonna get there. But I mean like for example, like we're going to the Netherlands at the end of June for a tournament. And like if I can get in as like I'm not going to be a serve sub, I'll tell you that. But if I can get in as a passing sub, like how cool would that be for me? And like that's kind of where I'm starting. But like if I were to look ahead, like the ultimate goal would be to be a member of the Paralympic squad. But yeah, I'm starting small, I'm starting realistic. Pass sub, put me in because I also don't know how to hit the ball. Um, I don't know how to do a lot of things, okay? But yeah, I think that's kind of just setting like small goals that are I forget, like the SMART goals, but
Hmm.
I don't even remember what everything stands for, but like more of like for me is they're achievable and they're realistic. Um, so that's kind of where I'm starting at.
That's awesome. I think it's cool
Mhm.
to have those like big dreams. Yeah, maybe they're not goals right now, but dreams, and then
Mhm.
you can start to work your way there through the smaller day-to-day goals like you're talking about.
I think
That's
it's cool to verbalize those too, because then when you get there and then maybe you don't play, maybe you do ride the bench and you're like a little disappointed, you almost lose that perspective of like, no, I'm at the Paralympics right now on the national team. Like it's
Mhm.
cool to look back and be like, no, this was a huge accomplishment and a big
Mhm.
goal of mine.
Yeah, for sure.
you mentioned not being able to hit, and that serving is a big thing you're working on. I found out today that you've been working with Nick Del Bianco
Oh
from the
my gosh, I
Athlete
forgot to
Wellness
like
Academy.
say that.
Yeah.
I
So
gotta say that.
yeah,
Oh my
he's
goodness.
one of our sponsors, the Arms Training Academy of the podcast.
Mhm.
And he said he's having a ton of fun working with you. He he mentioned that well, okay, first I want to know how it's been working with him. You don't have to like plug it or anything like that, but I'm curious what you're learning from him. And also he said you're still deciding which hand to use.
Oh my gosh, you guys, this is so embarrassing. Okay, yeah, okay. Let's start with how it's going. So I actually stop laughing. You can't laugh at me. I'm new. I'm a newbie.
I'm
Okay,
laughing. I'm laughing with you.
with me. Thank you. I appreciate it. Okay. No, I literally heard about the Arm Swing Academy through you guys,
Hmm.
and I when I was back in like when I was starting, I think I started working with him honestly 2 months ago. Yeah, 2 months ago or something like that. Because I've just been brutal with my serving and arm swing, and so I was like, oh, because I listened to your guys' podcast, like I love it. I'm a big fan. I'm learning a lot. I'm now actually understanding what some people are saying about like, oh, it's this like when you're in position one, doing this, and I was like, oh yeah, I know position one. Um, so I'm learning, like now I can actually understand some things. But yeah, so I heard about him through you guys, and I was just like, oh, like he could totally help me on parts of the game that I'm just really bad at. And so working with him has been so good. And yeah, I will totally like say to all your listeners, if you like can work with him, work with him. He's so good. I like just from working with him from 2 months, I've had two sessions with him. My serving, I like for 4 months, I could not serve it over the net. I can now serve it over the net, like somewhat consistently, and that is huge. And like even my coaches have been like, and my teammates comment on it. They're like, "Wow, like what happened?" And like I'm like, you know, I've just been like putting the work in, but no, it's Nick. It's all Nick. So yeah, he's a sponsor of this. Use him. He's so good. So
Love it. Love
there's
to hear it. That's
that.
cool. What are you guys working on right now? Because I guess
Oh,
for whatever, Jesse and I and most volleyball athletes, arm swing is natural. Like it's just something that we do, right? And it always can use improvement. You can always get better, get more power, healthier shoulder, all those things. But I can imagine just never doing an arm swing before, and then now that's your thing. So what did you guys start working on, and how was that process getting that going?
uh, yeah. Okay. So we started working on like he he was like, "You can't throw a ball," and I was like, "No, I can't. I never have. I'm sorry." And so he's like, "We're gonna teach you how to properly throw a ball." So he's like, he literally like lent me a pickleball, and I just practiced just like chucking it against the wall properly, proper form. He wouldn't be happy about that one, but and just like also learning how to like following through. And he's like, to get more power, it doesn't mean you have to swing harder, but it like means you just have to be more flexible and all these things. Like I'm learning so much. And so we're kind of working on that. And then yeah, can't believe he told you that. I I for 5 months I trained my right hand because I am left-handed, but everything I've done, like golf swing, tennis, whatever, like shooting a basketball, it would always be with my right hand. So I'm like, I'm right-handed. Um, so for 5 months I was doing that, and then it was at one of our sitting volleyball practices. I don't know, the ball came at me weird, so I just like hit it with my left, and my coach is like, was that your left? And I was like, yeah. And she's like, that actually looks better than your right. And I was like, okay. And then so she at the end of practice we were serving, and she's like, oh, can you like just serve a couple with your left hand? And I like no word of a lie, in 6 serves I got the serve over the net with my left hand, whereas it had taken me 3 months to get it over with my right. So in my head I'm thinking, I've just wasted 3 months of my life trying to train the wrong hand. But right now I'm working with him and he's like, I don't know, like I'm not convinced. Like he's like, they're pretty much the same. And so we're trying to figure out what hand I should be using. Like they want, like my team wants me using my left hand because I guess that's more rare. And here's me learning all these things. That's rare. And for the type of amputation I have, not having my right leg, but actually having my left leg allows me to like better push to hit the ball versus if I were have my right leg and I'm left-handed, I have to drag. I don't know.
Well,
It's
like
hard to
you
explain
have
like
more
without
you have
showing
more
you guys.
leverage, right? Like
Makes
opposite
sense.
Like there's
opposite
more
lev
power going into it.
yeah,
Mm-hmm.
yeah.
Because you can push off
Yes,
your leg
pushing.
if it's
Yeah,
the one
pushing
in the
versus
back. Yeah.
pulling.
Yeah.
Yeah,
Yeah.
exactly. So like they're like, okay, we're turning you like they were like, we're turning you you're left-handed now from now on. And with him, he's like, I'm like, I don't know, like I can definitely throw the ball harder with my right, but he's like, is that because you've done that your whole life? And like you haven't had like you've never done an arm swing before. And he's like, they're like pretty much the exact same. So we're trying to figure out what hand I am. Which is just so ridiculous, so embarrassing. Because I'm like, this is oh my gosh, like who doesn't know what hand they are? But yeah,
That's
so
just
he's
such a
been
unique
helping.
Yeah.
problem though. That's so
It's
cool.
a full clean slate.
Yeah.
This is awesome.
Yeah,
You
so
can
like I'm starting at basics.
that's awesome. Cool. Okay, well,
Yeah.
I've got to run, guys. Jesse, do you have any more things you wanted to cover?
Yeah, but it would take like 3 hours, I think. We'll just have to honestly, once you make the Paralympics, we'll have you back
Mhm.
on, and then we'll look back at this episode and we'll
Yeah.
all laugh.
No, this will be a great conversation to continue. Anna, that was
Yeah. Yeah.
honestly incredible. The most, by far the most impactful episode we've done. Hearing your story, what you went through, how you handled it, and then where you are now. Yeah, thanks for sharing. It's incredible.
Thank you for having me. It was fun.
Yeah, it was really fun, really special. And we're not joking. We will have you back on again
Hmm.
because I think there's lots more to talk about, and I think it'll be a great product for the listeners and also for Tias and I. That was just I don't know about Tias, but it gave me a new perspective on a lot of things. So thank you for that.
Yeah, absolutely.
Happy to do it.
Yeah, I think that wraps up episode number 37 of the Pit to Pro podcast. Thanks everyone for listening and signing off.